Hi everyone, I'm Dr. Madhumita. You know me as MedicoMadhu. Today I'm going to tell you a story of Mrs. Nilima. Mrs. Nilima is a 50-year-old lady, educated. She is a diabetic. She also has hypertension and she is on regular medication for both. Mrs. Nilima is a very diligent person. She goes for her regular health check. Every year, she gets her blood test done. She makes sure that her sugars are controlled, her hypertension is under control. She sees every year in her ultrasound there is something called as fatty liver. So one time she becomes totally curious. Why am I getting it every year? So she asks her doctor, Doctor, what is this condition that I have? Why do I have fatty liver? The doctor smiles at her and she says, Well, let me tell you everything about fatty liver today to you. Do you take alcohol? No, madam, I don't. I have told you. Good. You don't take alcohol. So what you have could be a part of NAFLD, non-alcoholic fatty liver disease, or the recent terminology is MASLD, that is metabolic dysfunction associated steatotic liver disease. So in this, what happens is your liver has some fat deposition. But why does it occur to me? It is a part of your metabolic dysfunction. You already have diabetes and you also have hypertension. There is insulin resistance. So you see that you have some metabolic abnormality taking place in your body. But is it going to harm me? How I can prevent it? Don't worry, madam, don't panic. You definitely have ways to prevent progression. You are at grade 1 fatty liver and it's so good. For the last 10 years, you have maintained it only at grade 1 fatty liver. You can try and reverse this. It is possible as long as you follow healthy diet. Reduce the carbohydrate source, reduce the fat source. Your liver is not going to get it. Anyway, you don't smoke, you don't take alcohol. So you're again ruling out those risk factors. Have plenty of fluids as much as possible. You stay physically active and concentrate on abdomen specific exercise as well. Drink hot water before and after meal. Have a good sleep. Avoid stress. All these things will help you in preventing the progression of fatty liver further. It will reverse to normal or it will stay only at grade 1 fatty liver. It is not going to harm you further as long as you're taking care of your health, like how good you're doing currently, and you can do even more. Mrs. Nilima is very happy and satisfied. She vouches to the doctor that I am going to follow all your advices. The next year when I meet you, I'll either come with just grade 1 fatty liver or there will not be any fatty liver at all.